Medicine, Dr. Clifford Shipley. Dr. Shipley was raised on a diversified farm in southwest Iowa. He attended Northwest Missouri State University, where he received his bachelor's degree in animal science, and then attended Iowa State University, where he received his Doctor of Veterinary Medicine degree. He practiced in Northeast Iowa before going back to his hometown, where he practiced for 3 years before taking a position at the Virginia-Maryland Regional College of Veterinary Medicine. He was there the head of the ambulatory practice and small ruminant and swine extension veterinarian for the state of Virginia. He subsequently relocated back to Iowa to manage a large swine operation and consult with a local feed company. Since 1991, he has taught veterinary medicine at the University of Illinois, where he became board certified in theriogenology. He was the attending veterinarian for agricultural animals for the University of Illinois, teaches theriogenology, pardon me, consults with deer farmers across the country, and has his own white-tailed deer and mule farm. He was on the board of directors for lost my spot, for the North American Deer Farmers Association for 6 years, an advisory board for New Dart, the Illinois Livestock Advisory Board, and the president for the Illinois Deer Farmers Association. He has presented at talks nationally and internationally on Cervidae. While not working, he plants and attends to his trees, food plots, and hunts. Please welcome Dr. Shipley. Thank you for agreeing to speak with us tonight, Dr. Shipley.
Well, it's nice of you to invite me, and I'm proud to talk to you, the New York State veterinarians, and any others that may be listening in. I hope I can answer questions for you tonight, as well as give you some general health program and ideas on herd health for Cervidae. If you want to flip the slide, that would be great. First of all, I am an expert. You can use whichever one of these definitions you like. It used to be a guy far away from a home with a box of slides. I remember losing a box of slides on a way to a presentation in the airline lost them for me. So always pack your slides. But today you can get everything on a thumb drive. So next slide. There are no courses, unfortunately, that I am aware of that talk about or general cervid healthcare programs and working with Cervidae, those types of things. So acquisition of skills, and you're all listening tonight. I hope I provide at least one bit of information for you that will make your lives easier. But acquisition of skills is quite difficult because the data is scattered. There's no one book on white-tailed deer or Cervidae herd health. The closest I can get to that for you would be, if you can find a copy, there's a book written by Hudson and Haig called Farming Red Deer in Wapita, and it's been out of print for a number of years. But Murray Fowler has some great chapters in his books, the zoo books. There was a group called Safe Capture International that I don't think is doing programs like they used to do. But most of that is about anesthesia, remote drug delivery, capture, etc. But a great course, and I would encourage you to maybe look for that in your area. They go around the country and do a lot for zoos and animal control places, etc. The small ruminant practitioners, if you don't belong, you probably should. One, the dues are cheap, and two, there's usually some discussion there on Cervidae, small ruminants, that hopefully will help you a lot. I did a lot of trial and error, and it's called building a bone pile, because there were things that I know now that I didn't know then, and a lot learned from a lot of trial and error. Extrapolating data is helpful, but a cow is not a deer and is not a goat. But certainly we can look at much of the data acquired from looking at other small ruminants and cattle and apply some of it, if not most of it, to cervidae. If you attend some meetings, the small ruminant practitioners have sponsored cervid information at some of their meetings, annual meetings. The North American Deer Farmers usually provides some health and welfare, capture, etc. Meetings at their national meeting. And then I think starting a collaboration or mentorship or working with other veterinarians that do some cervid work has been extremely helpful. And we're a small band of brothers and sisters, but we share data, share information, and I've never ever turned anybody down, and I've never been turned down by anybody when I ask questions. Next slide, please. Cervid farming worldwide. I think just a little bit of background for you on what happens in the cervid world. It's not just a North American phenomenon, it's a worldwide phenomenon. Velvet is a coveted medicament used primarily in the Southeast Asian Rim, and the prices for velvet antler have driven and did drive a lot of the market for a number of years, and still does in countries like China, Korea, and even Russia. So velvet antler is a profit area for many of the farms that do that, and that's usually red stag and elk are the primarily the two species of cervids that are used for velvet antler. Meat market is also an international market. Most of the venison sold in international markets comes from New Zealand farms, where they farm heavily red stag and to some degree elk, and elk crosses on red stag. There are also game farms, hunting preserves, whatever you want to call them, scattered around the country and internationally. And those are a place for people to enjoy nature and go hunting, provide meat, hobbies, etc. for other people. I have a number of my clients that are just hobby farmers. They love deer, they love being around deer 24/7, and it consumes their life. So hobby farmers comprise quite a few of the farms here in North America. And urine production is also a viable business for many of these deer farmers, cervid farmers. The urine is used primarily in the lure industry, hunting industry, to either mask scents or attract attractants for hunting to bring in bucks or to cover the human scent. So that just gives you an idea maybe of what goes on around the world and the country as far as cervid farming goes. Next slide, please. So why bother to farm cervids? Well, one, it is sustainable agriculture. It's done typically on a small basis as far as covering of acres, as opposed to extensive grazing operations for beef cattle, intensive farming operations for other livestock. So it tends to be looked upon as green agriculture, sustainable ag, etc., and where even a small farmer can make a living. And I'll use an example. Many of my clients over the years have been Amish, and their tractors are Belgian mares usually, and geldings, and so they can't farm a large area, but they can make a nice living raising deer. It's ecological agriculture. Typically, some people are using it as an organic basis, but most of the farmers that I deal with are doing vaccines, treatments for parasites, etc. Not a true organic farm, but it could be and can be, and it is used that way. It also helps diversify some farms in that they, instead of being a single monolithic dairy cow operation, they can take some of their more marginal land and use it to raise cervids. It requires a much smaller land base, so the opportunities to get into the business aren't predicated on having large land mass to do it. There are also lots of rural economic benefits to it. Texas A&M did a study. They've done 2 studies looking at the economic benefits of cervid farming. One was back, I think, in 2008, and the other was in 2015, and shows that it's like a $4+ billion industry in that it affects veterinarians. So yeah, you can make a very nice living providing veterinary care to some of these operations, feed mills, fencing companies, a variety of different economic benefits. And then, of course, those people that raise them as a hobby. And by hobby, also in this category, I would fit zoos and display areas where they display the animals simply for added income or a tour of the farm. I have a reindeer farm that I consult with. That's their business and their livelihood is their reindeer. Next slide, please. And game farms have been around for a long time. I deleted a bunch of slides for this part because you don't need to hear the complete history of game farming, but it goes back 40 to 10,000 BC, where people started, early humanoids, humans, started domesticating and fencing in, and sheep, dogs, wolves, etc., domesticated certain animals. We now have the technology in fencing and handling and general knowledge of management and nutrition that we can now farm some of these animals that were deemed undomesticatable. And domestication and farming of cervids and other wild animals was done back in the pre-Roman times. 10,000 years ago, there was evidence of farming reindeer in France. So it goes back a long time. Not a recent thing. Next slide, please. Our domestication of animals coincided with, of course, our leaving the country and starting to retreat to towns, villages, etc. And then our hunting, we didn't have to hunt because we were raising these animals domestically. We need to think back, and deer farms cause a lot of controversy, and they really shouldn't. I've got some nice flyers from the U.S. government dated in the late 1800s that was encouraging deer farming, both elk and white-tailed deer, and even moose. And there are moose farms in Finland and Norway and Russia. So it's a business or industry that's been around a long time. Next slide, please. Let's go to the next slide. You all can read and use your imagination. These didn't all get deleted like I thought they would. I'm sorry. There we go. That didn't delete either. Okay, why farm cervids? No, we'll go back one. by farm cervids. Let's go back one, try it. See if we can do that. There we go. And that number is incorrect. I thought I'd updated it, but obviously I had technical problems. I swear I wasn't drunk though when I did this. Swear. I might have been on other drugs for my pain, but not drinking. This is tea, by the way. So Y-Farm, we in Illinois and other places in the U.S. And the world, we raise deer as hobbies, urine production, meat production, velvet and hard antler, and then game farms and hunt ranches. Next slide, please. There we go. Now, the typical deer farmer is doing one of these things. If they're in the high-end breeding stock industry, they're paying and operating at the highest level of genetic advancement in deer farming. So they're selling breeding stock, both males and females. A lot of these top producers are selling semen. And some of this breeding stock is extremely valuable. I've sat in an auction and watched a buck fawn bring $1.5 million. So some of these animals that we are working on are extremely valuable. And actually, when I'm working on them, I prefer not to know because it puckers me up too much. Venison market is good, and that's where typically some of the producers, especially the red stag producers, elk breeders to a great extent, are selling their product as venison marketed in a variety of ways, many times directly from the farm, or they have their own custom shops. That sort of thing is very popular and can be very profitable. Antlers are also a big item in the cervid world, and most people think we raise them just for the antlers, and that may be true for a lot of people. But once again, velvet antlers are part of Eastern medicine and have been very valuable. And I'll just give you an example. Right now, velvet antler, prime velvet antler, is bringing somewhere in the $40 per pound range. A mature bull elk will cut somewhere around 40 to 50 pounds of velvet antler. That's a pretty good check. Now, pre-CWD 1998 and the world market crashing, velvet antler was bringing $200 a pound, and many of my elk clients were making a living just with a few bulls because the velvet antler was worth so much. Hunting is a part of the business of raising cervidae, and hunting preserves are found in a number of places, a number of states. They're also outlawed in some states. And regulations concerning hunting will vary state by state, and it makes it sometimes very difficult for producers to navigate the system. And that's one of the things that as a veterinarian you can help them do to become better with, you'll be writing health papers, moved permits, a variety of CWD inspections, TB, brucellosis. There's a variety of things that I do for my producers to move animals around. And then the other products that are there, I already mentioned urine, but also in Chinese medicine or Eastern medicine, the tail gland is worth a lot of money. The penis is also worth a lot of money, and the flexor tendons are worth quite a bit of money. I have a producer that raises Sika reds and elk, and they all go to the Chicago meat market, to the Chinese market, and he makes pretty decent money doing that. Next slide, please. Your role as a veterinarian and my role as a veterinarian varies. It covers a lot of bases, and quite frankly, um, I'd like to help you think that doing cervid work is fun. It can be profitable. It's not very hard work. Um, and quite frankly, I think that they've been shortchanged, well, as small ruminants in our school and professional teachings. They deserve veterinary care as much as any other animal does. Health, that's when everybody thinks of veterinarian, that's thinks of really a lot of times the owners think that's all we do. But health is tied usually to management, nutrition, and nutrition is very important. Deer are not sheep, and if you feed them like sheep, you'll kill them all. They need copper as a general rule. Food safety issues you will cover because some of the diseases that um, uh, they get can be transmitted to man. Not usually, but it can be. You may be counseling them on genetics. And quite frankly, the big thing today in the whitetail industry is genetics selection for CWD resistance. We may get rid of that disease by breeding out of it. And so you'll have a lot of producers that will ask you about what can we do as far as genetics go or breeding goes to help ourselves with CWD and other things like antlers and growth, etc. Reproduction is my specialty. I'd like to think I sometimes do a good job at that. But that consists of most of these elite deer breeders, and many of the other deer breeders are looking at advanced reproductive technology to improve their genetics, improve their CWD resistance, etc., and to make gains in their animals to make them more competitive in the market. So reproduction could consist of, and does for me, of collecting semen for sexing, doing transcervical AI, doing laparoscopic AI. I've been doing some IVF, and embryo transfer. So those things are opportunities for us as veterinarians to hopefully step in and fill that role, and we can provide producers really good return on their investment for their money. And there are other roles that we as veterinarians take on. I've had people cry on my shoulder in the parking lot over a dead deer, so moral support in a disease outbreak, as well as introducing clubs and groups to cervidae and cervid farming, a variety of things that you can do to help the cervid industry. Next slide, please. Now, your demand for service will vary depending on a lot of things. One would be the state you're in. If there's no cervid farming, you're not going to have much work. So you got to go, if you want to be a dairy practitioner, you go where the cows are. If you want to work on cervidae, you go where the cervids are. But cervids are scattered all over. And my practice with them started out as a farm here, a farm there, a farm here, farm there, until it expanded because they couldn't find other people to work on them. And I didn't mind driving and seeing the windshield, I guess. But your demand for service will probably center on most of these things, and chronic wasting disease monitoring programs is probably the primary reason I get phone calls. Most states have a monitoring program modeled after the USDA program. Some differences exist in those state programs, but most of them are consist of monitoring a yearly inspection, personal inspection, hands-on inspection. Sometimes it's over the fence inspection, etc. You also may be doing tuberculosis testing, And just a note on that, I'm assuming that all states are like Illinois, because it's run by USDA. You have to be certified to do tuberculosis testing as a veterinarian. So you'll have to get additional training, contact your USDA office. And I get do a lot of testing simply because there are very few veterinarians that are certified to do TB testing. Now there's recent developments that means within the last 5 years or so, they've allowed blood testing of certain cervidae, not all cervidae, but certain ones. And that's made life easier, but still some of them you have to do comparative cervical testing. And so that both require, both the blood test and the comparative testing require certification. Brucellosis is also a federal program. It can be run by the state in some states and just fall under the federal thing, but that's usually just a just a blood test for most part. Now, interestingly enough, whitetail actually don't get brucellosis. Elk do, and they can be a problem for some areas of the country, and especially in the greater Yellowstone area where there's brucellosis in the wild elk. So look at your state, federal programs, always make phone calls, try to find out latest information on what's happening with that. So when you're talking to the producer or the producer calls you, you can get the proper information to them about whether this bull has to be tested for brucellosis before he gets shipped to Montana or Idaho or Colorado. Health programs, typically for me, and I'll go into much greater detail, but I try to individualize my health programs for my individual farms because each farm is different, has different management levels, different nutrition, typically different stocking densities, and different set of diseases in some cases. So I try to target my health programs at that particular farm or ranch. Like I said, I do a lot of assisted reproductive stuff, and for me, that's all fun, and it can be very, very profitable. And there are a number, and growing number, it seems like, veterinarians that are doing assisted reproduction. Unfortunately, there's still a lack of veterinarians doing it because a lot of lay people are, I would say, malpracticing or practicing veterinary medicine without a license. And part of that's due, nobody stepped up to fill that hole. We're also involved heavily in identification. Most of these animals are identified at least 2 forms of ID, and some states require 3, and that could be ear tags, microchips, electronic readers, tattoos. And so you're helping my producers get the right identification and tags in is very, very important. Also involved heavily in movement of animals. You're writing health papers, getting move permits, etc. And movement may mean that you're also there to help anesthetize or advise them on an anesthesia techniques, sedation, etc. Also, you may be involved in the de-antlering process, which may be velveting, or in most cases may be removal of hard antler. And that's something I do this time of year quite frequently for producers, is we'll cut the antlers off. And you can think of 100 other things that somebody's going to call you about: a scouring fawn, a 2-year-old buck with pneumonia, those types of things. Next slide, please. Now, different species. Deer, a deer is not a deer, is not a deer, is not a deer. All cervids are not created equal. And by this, I mean You need to know what species you're working on, one, so you don't look foolish, and I've made that mistake before. So there are 32 plus different species of Cervidae. I've worked on probably 15 of those species over the years. And some of them, you look at them and you go, how do I carefully ask what the hell this is I'm looking at? Sort of like somebody bringing in their dog that looks like a pit bull but is a Staffordshire Terrier. So you need to ask. And the reason I say that is really simple. That reindeer on the right, I can kill very easily with a dose of xylazine in a bull in rut. And the fallow deer on the left, I probably couldn't kill with 3 bottles of xylazine. I might make it sleepy. So, and the goat there, that's a goat. And you're welcome to work on those if you like. So remember that, and that's especially true in anesthesia. And I would suggest there's a book. Krieger wrote it, I believe, is the main author. There's a handbook on wildlife anesthesia. It costs about $45, and it goes with me everywhere I go when I'm going to work on strange critters. Well worth the money. Next slide, please. Now, I'm just going to go over some of this, and I'll get to hopefully get more details later on. As was stated earlier, if you've got questions, please jot them down, because I'll stay to the bitter end to answer any questions. Cervids get parasites, internal and external, and some of those are deadly. There are blood parasites. I was just on the phone today with somebody that I believe they have in North Dakota, that I'm pretty sure they've got some blood parasites in their mule deer, both internal and external. Lice, ticks, depends on the area of the country you're in. There's a lot of, can be even lead to a lot of death loss, especially in the winter when these animals are in poor condition and are under the stress from parasites. Vaccination programs are difficult because, of course, there's no vaccines that I know of that are labeled for Cervidae. Everything is that's out there is typically either cattle vaccines, sheep, goat vaccines, and or autogenous vaccines made strictly for that farm, or in some cases now the USDA has really stepped up and allows non-adjacent farms to use some of these autogenous vaccines, and it's really made a difference for a lot of producers. Disease monitoring programs for CWD, brucellosis, tuberculosis, Johne's disease can be very severe and cause a lot of problems. And I've got one farm that has a real problem with Johne's that I hope we've got under control now. Next slide, please. And this is just a fun factoid for you, for those of you who care. This is an elk. That's a dewormer. I'm drenching it with some fenbendazole. That's an ivory tooth. And elk, red stag, and sika have ivory teeth there. So if you're doing a postmortem and getting the obex and lymph nodes out, and your producer hasn't stolen the ivories, please ask them and then take them. And you only have to post about 12 to get a 24, and that makes a beautiful necklace that your wife or spouse or trusted other will not wear. I know, I've spent $3,500 on it. She's worn it once. Should have known better. Next slide, please. De-antlering. And I just did a bunch of de-antlering last week, It's great fun if you like that sort of thing, and I do. Um, we take the antlers off of these animals for two reasons. One, I've already mentioned, is velvet antler, but the other is basically human and animal safety issues. If they are hard antler, and by hard antler, it is bone, they can be extremely dangerous. And there are people killed every year by cervidae that are hard horned or hard antlered. And I've had several of my clients attacked, hurt badly, put in the hospital, almost died. And I've had my fat ass rolled around a couple of times by an animal that didn't have antlers, and I'd probably be dead if I hadn't taken the antlers off. So you need to know how to do that. And if they're hard antler, it's really, really easy. You need to cut above the pedicle or the burr. And if you don't know what that is, ask the producer. They'll be sure to point it out, and cut them above the pedicle or burr. Because if you damage the pedicle or burr, their antlers will grow back next year abnormally, most likely. And I mean, by abnormal, I mean terribly abnormal. Some of them look like they've gotten mixed up in a pile of rope. It really looks awful. If you are cutting off velvet antler, and that's done typically on the red stag and the elk, and typically that's done in June. And there's a whole, I got an hour lecture on cutting velvet antler, but it's taken off at prime time, such that the velvet is worth the most money. And it hurts because you're cutting off an appendage. At that time, that is velvet is skin, and the antler's growing. It's like a bone, going to turn into a bone, and you need to provide some sort of anesthesia. And you may want to provide blood control, bleeding control. So if you're doing velveting, anesthesia, and you usually use just a local and a piece of latex tubing and wrap it around so I don't get so much blood. And it works incredibly well. I use a Sawzall because I'm lazy, actually because I had both my shoulders replaced and I can't do it anymore with the giggly wire. Sawzall, and use a coarse blade on that Sawzall. And my favorite for taking off velvet is a pruning blade. It cuts through that very, very nicely, does a good job. If you use a high number of teeth blade, they gum up and they don't cut worth a hoot. Okay. And when you're de-antlering them, that's a good time. You've either got them caught or they're anesthetized to do other procedures such as deworm, vaccinate, check their feet, do a variety of things to take care of them when you've already got your hands on them. Because that's the one thing you'll find out. You can't do things to cervidae at certain times of the year because of their physiological condition, i.e., growing antlers. You can't run them through a chute because you'll damage the antlers. So you've either got to knock them out or not do anything. So those types of things. Does in lactation, you want to run them through the chute? Probably shouldn't. If you drop them in a drop chute, they may rupture their udder. Really not very pleasant to look at and impossible to treat. So you need to understand those things and figure out the physiological stage of life they're in when you can and can't do procedures. Next slide, please. Here's I'm de-antlering some Psycha deer. They're anesthetized. I usually use on these guys. I usually use ketamine and xylazine, and sometimes add a little drop of acepromazine or azaparone to them. Wait till they go down. I blindfold them so they can't see. And here I've used the Sawzall to take off the antlers above the pedicle. And that makes them less dangerous to people that work around them, that are in with them or working with them, and to their compadres who I've started getting text messages and emails now about the bucks, whitetail bucks in captivity, and in the wild are starting to fight, and so they're locking antlers, goring each other, killing each other, and so we need to they can still bruise each other a little bit with antlers that are cut off like this, but they probably aren't going to kill each other. The problem that you see when you do this is that they still butt heads, and they can damage and get infections around the pedicle base. And a lot of these infections will damage the pedicle and can cause abnormal antler growth in the subsequent year or years. So popular in some places is to use calming agents in the feed, and there are a variety of those on the market. And some people use hormones to manage the rut, and there are hormones used to get the antlers to drop. And I'll spill the beans. That's usually medroxyprogesterone, and it can be given to a lot of reindeer producers use that to keep their bulls from killing people when they're on display. And their antlers surprisingly don't drop. If you give medroxyprogesterone to most of the other cervid species, their antlers are going to drop in a couple of weeks. And that may be good or it may be bad depending on subsequent antler growth, time of year, etc. Next slide, please. I'm going to talk about two diseases, not real quickly, because they're very important to the cervid producer. The major cause of death loss, and the first one I'm going to talk about kind of briefly is malignant catarrhal fever. And I just want to point this out, malignant catarrhal fever, because a lot of producers have other exotics, exotic sheep and goats on their places, or live in close proximity to other farmers or producers that have sheep and or goats. And malignant catarrhal fever kills cervids. It kills them, flat out kills them. And it usually takes 24, 48 hours, and they are sick and dead in about that amount of time. And it can kill all the animals literally on the farm. I've had 2 farms that have lost every animal on the farm. One was due to sheep across the road, and the other was due to sheep that were brought in. So it's always fatal. So I want you to be aware of that. It causes hemorrhage, and it looks almost exactly like epizootic hemorrhagic disease, or hemorrhagic disease, or blue tongue, whatever you want to call it. And we'll get to that next. Here's a bloody liver, gut liver. It looks bad. It is bad. Next slide, please. More bleeding. This is an abomasum. Here's the liver. Next slide, please. Heart, look at the hemorrhages on the heart, all over, petechial and ecchymoid hemorrhages. So they're bleeding to death, essentially. Next slide. More hemorrhage in the spiral colon here. This is in the kidney. Just more and more hemorrhage. Next slide. Now then, I'm going to talk about epizootic hemorrhagic disease. And this is, I don't want to confuse you, but 3 terms are used interchangeably in the industry, and it depends on whether you're standing south of the Mason-Dixon line or north of the Mason-Dixon line. North, they're usually going to talk about epizootic hemorrhagic disease. If you go south, they're going to talk about blue tongue. Okay. The proper term we should use, but we never do in cervidae, is hemorrhagic disease, because blue tongue and epizootic hemorrhagic disease cause hemorrhagic disease in cervidae. So depending on where you're at, you're going to hear those terms interchangeably, and I even do it. I slip up all the time because I'm talking to producers. So blue tongue, hemorrhagic disease, epizootic hemorrhagic disease is a viral disease that's, I would say in most cases, is probably 60 to 80% or more fatal when they get it. And a little bit of that depends on the strain. In epizootic hemorrhagic disease, we typically see 3 different strains here in the US: type 1, type 2, and type 6. There have been reports of type 8, but that data is not real clear Florida data. Not saying they're not right, it's just we don't see it around the rest of the country at the moment. When we talk about blue tongue, typically we're talking about blue tongue type 10 and type 17. So if you think about it, we've got 6 different serotype and or viruses kind of that cause hemorrhagic disease. And it's spread by a little gnat, Culicoides, and there are a couple of different subspecies of Culicoides that are implicated in spreading this disease. These are called no-see-ums, and they are so small you can barely see them. It's spread by these things. Typically, it's been associated with wet weather, then followed by droughts, because the Culicoides gnat breeds in muddy places and flies up to 3 to 5 miles looking for a blood meal, and typically bite these animals, start a viremia, and the animals die subsequently. And it can happen quickly in as little as I've seen animals that have died within 1 day of showing clinical signs. Typically 1 to 3 days and they're dead. There is a vaccine on the market that's been recently approved that has type 2 and 6 in it. And then there are, but that requires special dispensation from the gods to get that. But you can call MedGene, and I'm not getting a kit back. God, I wish I was. But anyway, call MedGene, and they can set you up to get the type 2 and type 6 vaccine. There are some other vaccines that may contain more strains. They are autogenous and may be obtained if your state veterinarian releases them to your producer or you. But they, once again, don't have all the strains in them. We're working on it. It's taken years to get where we're at, and hopefully we will get a good, effective multivalent vaccine. The type 2 and 6 vaccine, from the data that's been presented over the last couple of years, really works well if they get type 2 and 6. I had a producer, I love to tell anecdotal stories because they're humbling lessons that I've learned. I had a producer in western Kansas that was losing lots of deer. We got some samples into the diagnostic lab, and it turned out to be hemorrhagic disease, EHD type 2. We got the vaccine, we vaccinated, everything was going great. Next year, we vaccinated before season, had everything vaccinated up, and he started losing deer in August and lost more and more. And I'm like, oh my God, sent him in for testing, like you should do, postmortems. He's probably the only producer I have that willingly does postmortems. And it turned out to be blue tongue type 10. Well, the vaccine's not effective for that. And he proceeded to lose, I think, 26 out of 30 deer in the herd that he had left. So anyway, humbling. Anyway, next slide, please. This is EHD. This is more hemorrhage. And you can see the hemorrhage here. This is the spleen. This is the testicles. And they've hemorrhaged. And I've seen a lot of some deer, and mule deer especially, are known to survive EHD. Elk can survive, but it can render them sterile. And I've seen a number of sterile mule deer and a few sterile whitetails from post EHD recovery and or blue tongue recovery. This is the trachea, lots of hemorrhage, small petechial hemorrhages here. Next slide, please. Here I'm just out having fun. You can't have more fun. Here I've got a couple students. We've darted a deer. I think if I remember right, we're doing an epididymiectomy to sterilize this deer because the owner thought that'd be a good idea. Anyway, next slide. I'm just going to talk about some common things here as we go along and talk about. I get lots of phone calls on what are these? Okay, these are papillomas, and I've seen deer literally covered with them. Like occasionally one of these warty cattle that you see that, has 30 pounds of warts hanging off of them. I've seen that in deer. This just happens to be, most commonly I'll see it in 6-month-old to 2-year-old deer, and they may have 1 or 2 or 20 warts, typically just 2 or 3. And if you ignore them, treat them with benign neglect, they will go away. Occasionally I'll treat one when a producer has a deer that's being bothered by one and bothered by one. I typically mean they're having vision impairment or feeding impairment or something like that. I will take them off. And by the way, give them a tetanus shot and put a rubber band around that, or a little green band if it's small enough, and they'll fall right off. Next slide, please. Oh, sometimes you get to do C-sections. My student had a great time there, and you can see the sterile surgical area. That hay's been sterilized by UV light. I just want you to know that. Here in Illinois, that's what we use. We can't afford anything else. Next slide. So more health things. Nutritional monitoring is part of most of my herd health programs for Cervidae. And as I briefly mentioned earlier, copper, they need copper, and they need lots of copper. And just to give you an idea, most of the cervid diets that I look at should contain somewhere usually 30 to 50 or more parts per million copper. And if you saw that in a sheep diet, you would faint dead away because you want to be less than 10. A lot of people, besides giving copper in the diet and the feed, they will give copper injections, copper boluses, copper added to mineral, etc. And especially some of these top growers of bull elk and red stag are really pushing the copper on them pretty hard. Selenium can be a problem. Once again, check your area. If you're deficient or in excess, you need to know that, and your diet needs to be adjusted accordingly. Typically, 0.3 parts per million is fine, but in limited areas where there's not very much selenium, that may need to be supplemented. And BOCI injections to fawns, to doze, etc., prior to parturition, etc., can be very helpful. Most producers and are opposite of what we find in a lot of other species. These producers tend to overfeed protein, overfeed it. And so you'll see 18, 20, 22%, 24% diets. I've seen them even higher than that. And there are NRC guidelines on white-tailed deer. And the highest diet you can find in their NRC is 17.6% for fawns, I think. So look at the protein. People are burning them up, overfeeding protein, doing a variety of things, and it's not healthy for the deer, and it's certainly not healthy for the pocket. But protein costs money, and it's part of my nutritional monitoring program. I collect feed tags and look at them, kind of a hobby. I want to know what's going in those animals and what they need. And a lot of diets are homemade. A lot of diets are homemade or given from one producer to another producer, and no one's ever analyzed it. So don't be afraid to jump in, get people to analyze their rations, get them taken care of, do it right, because you will help these people dramatically in their herd health by doing proper nutrition. Probably one of the things you're going to be frequently called on to help with, and producers have to get their drugs now somewhere. I jokingly say, well, you can get any drug you want, it seems like. And a lot of my producers have more drugs than I do. And I sometimes wonder where they get them. And then I go, do I really want to know? Maybe I do, maybe I don't. But tranquilization and capture goes along with handling Cervidae. And you need to be aware of the drugs that you can use, have on hand, and should be used for in capture and reversal. The same thing with medications. Typically, I'm talking about painkillers like Banamine, meloxicam, those types of things, and then antibiotics and what we can and can't use, should use. And I'll just throw out a question for you. Do you know how many drugs are approved for use in Cervidae in the United States? Pop quiz. Pop quiz. The answer is 2. Xylazine and Safeguard, or fenbendazole. And fenbendazole has a zoo license, so everything's off-label when we deal with Cervidae, almost. Next slide, please. So that's a fawn on my doorstep. Next slide, please. We're going to talk about neonates here. Colostrum is liquid gold. It's the most important factor in disease management on the farm. These fawns need to get colostrum first 12 to 24 hours post-birth. And the problem is we never know if they nursed. And we shouldn't know if they nursed, because that means we've probably interrupted the mother fawn calf bonding process and may have made them reject their fawn. So it's really a tough one to assess. Binoculars work great. Catching these fawns at 12 hours, 6 to 12 hours, depending on the situation, and checking to see if they've got a full belly, because you can palpate them, that sort of thing. This is where they're getting the antibodies to the diseases the dam has been vaccinated for or are common on that farm. And so very, very important. Matter of fact, if you get a colostrum in them, you're probably going to have well fawns. No colostrum, dead fawns. Colostrum also has vitamins, minerals in it. It's a laxative. And there are immune factors in colostrum that stimulate and help the immune system. Incredibly, incredibly important. And I keep colostrum on hand. And you're like Well, how do you do that? Well, if a doe or cow, or a hind loses their fawn and or has a history of having a large bag or producing lots of milk, I may knock them out and steal some colostrum from them and freeze it. Or if they lose a fawn or a calf, I will restrain them. Usually you have to knock them out to milk them out and freeze that colostrum. If you don't have that, sheep or goat colostrum is better than nothing. If you don't have that, cow colostrum is better than nothing. And if you don't have that, there are colostrum replacers on the market for sheep and goats and calves, and those are better than nothing. The trick is to try to get that 10 or 20% of colostrum into them in the first 12 to 20, 10 to 20% of their body weight into them in that first 12 to 24 hours. It's really, really important. Next slide, please. Sanitation. Your mother was right when she said cleanliness was next to godliness. Having them in a clean environment, and that means to me, I'm going to have these does or hinds or cows out on pasture that's clean, no mud holes, not mud, not dirt, clean, fresh grass if possible. So clean environment, and we all know that. We're veterinarians. We know that. Disinfectants, clean the waters, clean the pans, clean everything, disinfect your taggers, etc., etc. Mud is a death knell for these things. Try to have good drainage for them. If you're putting them in barns or pens, make sure they're ventilated. A lot of people are pulling fawns at 24, 36, 48 hours to bottle raise, and that's fine. Don't have any problem with that, but make sure they have good ventilation and the pens are dry and well cleaned, well ventilated. The bottles should be clean. If they're bottle feeding, make sure the bottles are cleaned and disinfected after every use. The equipment, most cases I like to have designated bottles for each animal so we don't have spread disease. And I tend to raise fawns solo in just like we think of dairy calves and calf hutches, so we don't spread disease between the animals. Next slide, please. And so raising neonates is going to depend a lot on the farm and what they like to do for their management system and what their goals are. Some people raise them in groups, and that's fine. I tend to think that group housing is a great way to spread disease. So I do individual housing. The other reason that people tend to hand raise them is to make them tame. And if you group house them, they don't seem to stay as tame. I almost want them individually to bond to me, so it makes them easier to handle. And I only do this if possible with the replacement females. I do not like to hand rear males. If you hand rear males, whitetail mule deer, red stag, elk especially, any of the male species, then have absolutely no respect for you, life, limb, or your safety when it comes to the rut. They look at you as a rival and will try to kill you. And if you don't believe me, read up on it. Bucks should not be hand reared. However, sometimes you have to. If they're orphaned or triplets or quads, I won't let them die. I will hand rear them, but I will treat them as a zoo would, where you do it semi-remotely, don't pet them, don't do anything to them, Don't let them see your face, or just get them started on a bottle and feed them, and then don't interact, that sort of thing. Prick nipple is my favorite for most smaller cervids. For larger cervidae, a lamb nipple, goat nipple, or even a calf nipple will work. And so you have to work with your producers to figure out what their goals are for their production system to help them adequately. Next slide, please. There are lots of milk replacers on the market. A lamb milk replacer is not an adequate milk replacer for most cervidae. So goat milk replacers will work, but there are companies that make species specific, i.e. I can buy white-tailed deer milk replacer. I can buy mule deer milk replacer. So try to get something that's species specific. The animal, the fawns or calves are going to do much better with that than they will with an all species or a cheap high ash product that's a lot of producers will go get at the farm and fleet just because they don't know better. So look at milk tags for them. How much they should consume. They should be getting somewhere between a minimum 10, and they probably can't consume more than 20% of their body weight per day. And I get in an argument with producers all the time. They've read somewhere where the fawns need to be fed 6 times a day or 8 times a day, every other hour, 2 ounces, etc., etc. If you read the data from wildlife, and I'll use white-tailed deer as my status thing here, is they nurse in the wild 2 to 3 times a day. That's all. So that means you can feed them 2 or 3 times a day. And typically I start them out at 3 times a day and then get them to 2 times, whatever. And so I'm feeding them 10 to 20% of their body weight, split into 3 or 4 feedings, and gradually get that down to 2 feedings. Quality is very important, as I previously mentioned, and some milk replacers used to have, they don't anymore, have antibiotics in them. But sometimes when I am treating groups of fawns or individual fawns, I can put antibiotics in the milk at feedings or anticoccidials throughout the milk feeding time to control disease. So you can do that. I used to use a lot of Decox-M in the milk replacer and control coccidiosis in fawns that way. Next slide, please. Creep feeding. I try to have some area where the fawns or calves can get to water. The feed can be higher in protein. Once I said 17.6 was the highest I found. So I typically try to get these fawns on an 18% ration, but a lot of them, there's only one company that I know of making fawn starter, and I think it's 20%. So you may end up buying that, and that's okay. But I wouldn't be feeding 24. Free choice hay and forage. Typically, that's the best alfalfa hay you can find because they will pick through things and waste things. Most of my producers will also hand feed leaves, dandelions, pieces of apple, grapes, get them started on treats so they remain very, very tame for handling purposes. When to offer, I basically offer them those things if I'm bottle raising within the first week, 10 days. Next slide, please. Weaning can be done as early as 60 days. Most people won't do that. The classic weaning time for whitetails and elk calves, red stag, is going to be sometime between 3 and 4 months of age. Maybe later, and some people won't wean they'll just leave them on, and gradually the doe will wean them, that sort of thing. Feed, water, pins. I typically wean what I call a soft wean, like I do in cattle, where the fawns or the females are across the fence from the offspring, so they can see and hear them, but they can't nurse. And typically that works pretty darn well. Next slide, please. Disease of the neonate, they get bacterial infections, and typically this is going to be an E. coli or salmonella causing diarrhea. They get viruses, same as all other our other species that we doctor to, corona, rota, etc. And they do get parasites. Coccidia is probably the #1 problem on most deer farms, and a lot of deer farms don't know they have it. But if we can do coccidiosis control, the fawns and calves are going to do much, much, much better. And then we should be doing fecals and doing a good deworming program for them as well. Next slide, please. So control of disease, sanitation, ventilation, colostrum, antiparasitic drugs to the milk replacer, antibiotics to milk replacer. Typically vaccination for Clostridium perfringens C and D, and I want to make a special statement here. Try to vaccinate them for A. I see lots and lots and lots of A in cervid neonates. So if you can find it, get it, or it's in an autogenous vaccine, do it. Antitoxins, antiserums also can be very, very helpful, especially Clostridium type C and D antitoxin, if you can find it. I think it's scarcer than hound's teeth in the last few years. Next slide, please. Treatment of diarrhea, small cervids don't have much reserve buildup. It's easy for them to dehydrate and use all their fat stores. So treating them early and getting them started. Typically use calf electrolytes. If you're going to use electrolytes, don't use Pedialyte. Don't use Pedialyte. Use calf electrolytes or sheep or goat electrolytes. Antibiotics, one of my favorites is cheap, easy, the SMZ TMP. Go flavored, grape flavored, cherry flavored, put it in the milk, squirt it in the back of their mouth. It takes care of, usually takes care of bacteria and coccidia as well. Milk replacer, don't forget the anti-inflammatories. And if you're treating elk with diarrhea, don't use, watch your sodium content. They can die of hypernatremia. Next slide, please. So pneumonia, treat them early. Many times you won't notice them being sick, or the producer won't notice them. But if you watch them real closely, their respiration rate will be up. They may have a mild cough that's exacerbated by exercise. Take their temperature, they're running a fever. Treat them aggressively. Don't let them get 3 or 4 days into it before they get treated. Just like any other small critter we're working on, neonate, we're going to try to treat them early. So antibiotics, anti-inflammatories, get them isolated from other critters so they don't spread it around. Next slide, please. Bloat, you'll see a lot of bloat in these neonates. And the first thing I think of when a producer calls me and says, I have a bloated fawn or bloated calf, it's Clostridium, usually perfringens type A. So I treat them with penicillin typically, and every pharmacologist in the room will roll over in their grave, but orally and sub-Q at a high dose, and typically the next day they're fine. Don't overeating is often blamed for this. It's not. It's probably irregular feedings, maybe improper milk, improper mixing up, et cetera, et cetera. And I'll throw in one thing there at the end that'll puzzle all of you. And if you know the answer, please let me know. Most producers are giving their fawns clean dirt, misnomer, whatever, clean dirt. And I don't know why, but if they don't seem to get some dirt, they will paw down, they will try to eat anything, trying to get, I assume, some sort of normal gut flora established, or there's something that they're trying to do GI wise. So I typically will provide new fawns, clean dirt, go out in the forest area where we're far away from the pens so I don't have any contamination from anything, and put clean dirt in their pens for them to eat. And it seems to stop Clostridium as well, or the bloating. Next slide, please. You may be asked to help with facility design, handling, behavior, feeding, genetics. Those are all areas that require, the more farms you get on, the more you're going to learn about handling, behavior, and deer. I'll tell you one thing, they're flight animals. They're not fight animals. Now, they will fight if they get in a corner, and they can slap you across the side of the head with their front feet so fast you won't see it coming. But typically they're going to run away. And so if you think of that when any of your working animals and looking at facilities or helping troubleshoot facilities, make it so the deer always think they're getting away from you, getting away, out of your sight, going into the handling facility, going into the tunnels, going into the chute. Make them think they're getting away, and life will be much, much easier for you. Handling them, I actually don't mind handling deer because typically they're in a drop chute and can't hurt me, and or they're asleep and they can't hurt me. And I can usually find 32 people standing around watching me that I can pick them up and move them where I want them. So it's kind of fun to work on deer as opposed to trying to necropsy a 2,000-pound bull. Just not much fun. So handling, behavior, they're flight animals, take advantage of that. Feeding is easy. And genetics are going to be a question. I've already covered that just a little bit on the CWD resistance thing that we're now following down the trail, both in elk and whitetails, and hopefully the other species will catch up as well. But a lot of species, the cervids, don't get CWD, so we only have to concentrate on like 5. Next slide, please. Management, help people. A lot of people are going to build homemade equipment, and that's okay. Most people don't know what they're doing or haven't been on very many farms. These are box stalls with sliding gates and a hydraulic floor of the drop chute. This is an elk handling facility that would also work well for red stag. It will not work for whitetail or mule deer. It will not work. So there, you need those. You need to understand that. Each species is different and requires different handling to some degree. Next slide, please. These are working stalls for elk, work very, very well. Sliding boxes, they're very visual. You can get them to move ahead. Elk are actually pretty darn easy to work in a proper handling facility. I will tell you that they kick and they will bite, not usually, but they will kick and strike at you. So you need to be careful of that. But a good handling facility, and this is a squeeze chute. They walk in this large boxed area, and I can't find my arrow now anyway, but the boxed area here in the middle, is run on the hydraulics and just squeezes them and then lifts them off the ground. Next slide, please. It's access to the rear end for doing AI or for collecting semen from a bull. Works very well. Very good system. Next slide, please. More box stalls. These slider gates are wonderful for working out. Next slide, please. This is a spiker bull restrained in a squeeze chute with a lift. So he's just, his head is sticking out. He's been tagged 3 different times. You can see for ID. He's got he's just starting to grow velvet antlers. This chute has a drop down door so I can access it to bleed, take blood, and or I can take blood out of the facial vein or do TB testing and or reach in through the sides to give vaccines. It also has an opening at the bottom to access them for semen collection. Next slide, please. This is a really, really nice white-tailed deer handling facility. You don't even have to get in with the deer. You can see the pulleys and ropes and different pins, and they're all numbered. You run the deer in through from the outside pins. You can sort them, and then there's even a push gate that pushes them inside of the building to get into a handling system. Next slide, please. This is another squeeze chute. The animal walks in there, you squeeze them, and this one doesn't raise them up, it just squeezes. So it's not as nice. And actually, I wouldn't work anything but elk or red stag in that. I would not work a whitetail in there. Great way to kill them or get yourself killed. Next one. Bulls can be dangerous. The bull on your right helped me over the fence. The fence is 7'8", and I can go 7'9" with proper motivation. They're dangerous to be around, and in hard antler, they hurt each other and can hurt humans and just tear the hell out of facilities. Next slide, please. More management slides. Elk. This bull's in hard antler. He's been blindfolded, and his antlers are going to get cut off for safety purposes. Next slide, please. Just showing you the outside of that chute, hydraulic system. The operator can stand there and run that all day. Very easy to work animals, not hard to do at all. Very much similar to a hydraulic chute for working cattle. Makes your life lots easier. Next slide, please. More elk handling facilities. You can move animals around in this facility, sort them, load out here in the corner, back a trailer up. Very easy to work animals in this system. Next slide. And this is a alleyway, and I told you these animals like to get away. So if you can imagine on the left, driving them out of the pasture, and they duck down this alley because they're getting away from you, and then they duck in the barn because they're getting away from you. And so you hide behind that swing gate, and you can handle animals very easily in good facilities. And if producers don't have good facilities, promote good facilities. It's cost effective to have good facilities. Next slide, please. This is a reindeer chute, and they're really complicated. This is just basically 2 mattresses in a V, and you squeeze the animal together. Reindeer are easy to handle. Most of them are halter broke. Here we've squeezed this animal in, we're restraining it. This one doesn't have a halter on it, but just holding on to the antlers. Here we're tagging it, we're trimming its feet. You can do castrations. And the one stick out thing you need to understand about reindeer is they do get West Nile. So it's important you tell your producers about vaccination for West Nile. They are, of the cervids that I've worked with, they're probably the hardest to raise in captivity. I mean, reindeer farmers have a real job trying to raise them, just getting them bred, having them calve. The calves are hard to raise, get sick, etc. They're really, really tough, and you need to be on your toes working with reindeer. They're fun, but they're tough to raise. Next one. This is a reindeer bull, and they like to play games when they go hard antler. And this is a big boy, a really big boy, and he's in rut because he shed his velvet, and he is pissed off, and he's got his head down. And if you aren't scared of him, you should be. Now, if you're going to work with reindeer herds, and I'm certain that some of you probably do, one of the things that you will be asked to do is probably either cut these antlers off, but they're so beautiful and they're so nice to display that most people are reluctant to. And I understand that. Your key to life here is to give them medroxyprogesterone, and it'll cool their heels in about 24 to 48 hours. Now, reindeer usually don't drop their antlers from that. Other cervids will, but you can repeat that every 4 to 8 weeks, depending on the bull, and keep them on the display circuit without endangering people. Now, if they're really, really nasty, they should be locked away, shouldn't ever be trusted. But I could say the same thing for most male animals, adult male animals. They should be never trusted and never turn your back on them. Next slide, please. Injuries are incredibly common, and these animals are, I jokingly say, are born looking for a way to die or kill themselves. Elk, this is an elk cow, and she's torn her lip badly. She ran into the fence, but you'll see broken necks, broken legs, broken backs, fractured jaws. I've seen broken antlers. I've seen damn near every cervid injury to the body that I can see. And that's good and it's bad in that if you have good facilities, they don't get injured very often. If you get a lot of injuries, then you need to have your facilities or where those injuries are occurring. But the great news is they heal really, really well. So in spite of yourself, you can probably save a lot of these injured animals. Next slide, please. And I mean that I've seen some horrible fractured legs and antlers and skulls, and they've healed remarkably well. This is a bull that's broken his velvet antler. And the cure for that right there, just cut it off. It's a piece of bone sticking out. I sometimes sew the velvet back over, do a cosmetic job, and sometimes I'll just leave it open and cover it with fly spray and antibiotic because they can get antler infections, and which can go septic, septicemic, and they'll die. So you need to be very, very, very aware of antler injuries, infections, maggot strike, fly strike, etc. Next slide, please. This is that handling facility for whitetails again. Here's the control box. So the animals aren't spooked because they can't see humans. It works very, very well. Next slide. Reproduction, I do a lot of semen collection and freezing. Well, actually, I don't anymore. I've kind of slowed down in my old age. AI can either be transcervical or laparoscopic in these species, depending on the size. and cost of semen and a variety of other factors, you'll choose which method you use. You may be involved in synchronization programs. That's easy. Almost all Cervidae, almost all, are seasonally polyestrous. So, and most of that means in the Northern Hemisphere here, most of our species are going to be coming into rut in the fall, and they're going to be out of rut and not cycling, etc., usually from about March to September, depending on the species. The rest of the time of the year, they will cycle. So synchronization programs for breeding is going to usually consist of using some seeder program and various lengths of time the seeder's in, pull the seeder, give a shot of equine chorionic gonadotropin and breed it as timed breeding. Pregnancy diagnosis, you may be doing ultrasounds, you may be doing blood testing, you may be just doing rectals depending on the size of the animal. Embryo transfer is really growing in this area, and it's basically easy to do, not much different than sheep, goats, etc. And some of it's being done. Some of our species are getting endangered, and/or we're trying to spread them to other parts of the world that don't have them. And it's easy to move an embryo, not so easy to move an animal. Next slide, please. I've got a 2-hour lecture on chronic wasting disease. I won't do that to you. I'm going to go through this really quickly. There are federal regulations. There are state regulations. They vary from state to state. Most states have monitoring programs that have different statuses. There are states that are free. There are positive states. I believe we're now up to 30 states that have CWD out of the 50. And so it's going to keep spreading. I'll just tell you, it's going to keep spreading. Fish and Game and wildlife and state health programs all usually have some sort of a monitoring program with them that consists of hunter harvest, found deer, and farm deer. So you'll be taking samples, and most of that means you're going to be taking Obex and retropharyngeal lymph nodes. But also in today's world, some states allow live testing, and so that may be a rectal biopsy. It may be doing a tonsil sample on a live animal as well. So sampling is going to be in your realm for the most part, and is very important to the producer to have CWD monitoring so they can stay in business. Next slide, please. Tuberculosis is not very common, but we do find it in Cervidae in the wild in Michigan, and they've got a testing program, and they've got a certain area of the state that's marked off. To the best of my knowledge, no place else in the country has it in Cervidae. It's been 2 or 3 years since it was last found, I believe, in a red stag herd in Indiana. Typically, it can consist of blood test or the intradermal test, and the testing accuracy is pretty good. But I have killed more animals that were reactors that were negative on postmortem. I have never had a positive. So, and one of the caveats with reindeer here is they suggest maybe doing them only in the winter so they have less reactions to non-specific TB or bacteria. Next slide, please. This is just an elk doing a mid cervical test. Shave, inject, we'll come back, read 72 hours. Next slide. Brucellosis, you need, some states still require negative test or herd to be on a program, accurate blood test, so you'd be bleeding. I've got an elk in a working box, and they can't handle the bull, so we roped him, and I pulled him over to the side of the thing, and I bled him. Next slide, please. Don't do what I do. Health programs, I would tell you that Clostridium is a real disease, C and D and A. Lepto, depending on the book you read, whitetail don't get lepto. Elk maybe do. So you can use a cattle vaccine. IBR, BVD, PI3, not for deer, not for whitetail. Maybe BVD in elk. So use a killed product. Use a killed product. And if I do vaccinate for any diseases using cattle vaccines, I always use a killed product. You don't want to be doing modified lives in a non-target species. E. coli, vaccinate for it, but don't depend on it, because I have never had a deer diarrhea sample ever come back with a K88, K99, or any of the other serotypes. I do use autogenous E. coli vaccines for farms, though, and I really think they work. And I get lots of different E. colis. So the West Nile virus, nothing's labeled for reindeer. So you're going to use an equine one. Once again, you're off species, use a killed product, get it in them, do 2 initial and a booster every year at least. Reindeer are awfully expensive, so don't forget that. EHD vaccines, yes, please use them. Please understand how to use them and the downfalls and pitfalls of using them. You may include other vaccines in your health program. A lot of my farmers are using autogenous that contain Fusobacterium, Truparella, Pasturella, etc. So I've got a lot of custom vaccines out there over the years, and they help on quite a few farms. Some don't work at all. Next slide. Parasites, don't forget, have people do fecals. They never do, but you can still preach it. Internal and external parasites. Some of the porons do actually work for cattle. They're labeled for use in Europe, but they're not labeled for anything here. So don't be afraid to use paste or porons. But remember my caveat, if you're feeding dewormers, you never know who ate, and you never know how much they ate. So I do double dose 3 days in a row if I'm deworming and feed. That's probably overkill, but I feel I get along very, very well with it. And we're going to have parasite resistance just like we do in all the other species. So look for it, it's going to happen. And using albendazole, remember, can cause birth defects at certain stages of pregnancy. Next slide, please. There we go. Nutrition, I've already talked about it, but remember they go through different lifestyle or life changes physiologically, lactation, gestation, breeding. So they need different levels of feeding at those times. I typically feed 2 rations to the adults, a 16% ration to bucks growing antlers and to does in lactation, and a 14% ration when they're not growing antlers and just gestating. Fawns get 18%. Make sure they forage. Different species of cervidae will fall into different groups, whether they're browsers, grazers, or selective eaters. White-tailed deer prefer to eat petunias and roses. Elk are semi-selective in that they will graze, but they also like to browse. So And it's nice to give them forages. It keeps their rumen working. It keeps their minds right. It keeps their rumen right. Everything's better that way. So monitor their nutrition programs. Next slide, please. And specific health programs, you can read this slide as well as I can. For specific diseases on specific farms, I will do specific disease control things. That happens to be a deer that died from hemorrhagic disease. This producer lost 104 out of 105 animals over a period of 3 weeks. Really disheartening. Next slide, please. My treatment philosophy is very simple. Do no harm. Okay. Some people think I'm old and crass and don't care, but some of these animals actually do better with no treatment than with treatment because of the stress of treatment, the anesthetics you have to use, handling, et cetera, et cetera. I mean, there's a lot of different reasons. And I'll give you a quick and dirty. High breaks, high fractures in legs, the animals will heal. I almost can guarantee it. Lower fractures need to be splinted or euthanized. And that's a generalization, but it works really, really well. And people will say, well, you can't leave it with a fractured femur because it's painful. Well, treating it is worse than just leaving it alone, and it will heal. So just be careful. Tame versus wild animals, it's one of those things that always happens to me. Doc, you can walk right up, it's tame, you can give it a shot. And I walk out there, I'm a stranger, I'm in a zoot suit, and the animal takes off and never to be seen again. So think of whether the animal's wild or tame, whether they have good facilities, how you can treat that animal. I will treat in the water sometimes if I can. You have to have complete control. So water for pneumonia or coccidiosis, scours, other things, etc. And I have people with lots of pets, and we treat those as pets. I had a lady with a 22-year-old deer named Lily, and she ate her banana with meloxicam daily. So it can be done. Next slide. Parental, if I'm given antibiotics, there are some great new antibiotics, and by new, I mean within the last 5-10 years, we've got antibiotics that last a long time. And treating these animals daily is really, really hard on them. And so if I can choose an antibiotic that's going to last 5 days or 7 days or 10 days, and actually there's no pharmacological data on a lot of these drugs in deer, but you can assume that they typically are going to work. But deer have a faster metabolism, so they either require a higher dose or a shorter treatment interval. There's nothing approved, so you're out on a limb, but nobody's going to prosecute you that I know of over treating an animal if you put a proper withdrawal on it and you tell the producers about meat withdrawals and safety and all that good stuff. Some of the things are very irritating, some are cause problems. So sub-Q is the way to go without damaging muscle, especially on neonates. Some of them are too thick to dart. So I treat a lot of animals with a remote delivery device, i.e. a dart gun, low volume, highly concentrated things. But you can make an animal very, very wild in a very, very short period of time by treating them. But sometimes it has to be done. Next slide, please. I'm not going to talk about this much. I've already talked about it. These are opportunities for us as veterinarians to help producers, especially if you like to do repro. These are very much a high profit area in the business, and I'll leave it at that. Next slide. Identification, once again, I've covered that, I think, adequately. Make sure your producers are adequately identifying their animals. Next slide. And they need to know how to put in a silver tag, because most people don't know how to put in a silver tag. Help them out with that, please. It'll save animals' lives and save re-tagging them. I think I've covered this. A lot of these animals require tranquilization to move. You're going to be helping them with that. Next slide. I've got a dart hanging out of this deer's ass, and he didn't go to sleep, and I'm hitting him with a pole syringe. Next slide. Lots of different ways to do it. I've got a pole syringe, dart gun. I can hand inject, blow dart, water meds, feed meds. And I do all these things routinely on farms, movements, working on the animals, etc. Next slide. Xylazine is a great drug. You can concentrate it, so you can use it in a dart gun for up to 450 milligrams per mil. I've made that in my own oven, pop the top off, evaporate it, and rehydrate it. And you can use get xylazine made by many of the compounding pharmacies at 300, 200, 333 is a common one as well. It's reversible, it's cheap, and it's actually approved for cervid use. Next slide. Ketamine is probably my most common drug other than xylazine to use. You can concentrate it up to 180 to 200 milligrams per mil. So once again, it works great putting in a remote delivery device. It's a controlled drug. And I've got a thing there that says must wait 40 minutes to reverse. And that's commonly repeated in the industry. I will tell you that you can reverse them earlier than that, because by the time it works, that's 10 to 15 minutes before they go down. You've got 10 or 15 minutes to work on them, or longer, depending on what you're doing. And then it's going to, I give my reversal immediately after I get done working with them, because it's going to take them 10 or 15 minutes to work up, and the ketamine's already going to be burned off. So they're going to wake up fine. Next slide. Other drugs that you may run across, and I've got them all, okay? Because I use different things for different critters, different procedures, different things. You don't have to have all these. Telazol works great in combination or by itself. Carfentanil is a wonderful drug, but you can't get it anymore. And it's the drug of choice if you look in most anesthesia things for wild cervids. Medetomidine is wonderful. It can only be reversed with atipamezole, and it's expensive, and the dose is small, but it's a great drug. Naltrexone for reversal of the opioids, atipamezole. Azapirone's a wonderful tranquilizer. Azpromazine works really well, chlorpromazine, etc. But I'll have people call me and they want to know what drug they should use to knock out such and such fallow deer that they're working on today. And the first question I go ask them is, what do you have on hand? Because the preferred drug might be carfentanil, xylazine, but if you don't have those two drugs, you need something else. So familiarize yourself with one or two or three combinations that will work for you, cover 98% of your needs, and the producers can use. So very important. There's a combo that's not on here. There's two combos that are not on here, I think. One is a BAM combination, BAM. It stands for butorphanol, azathioprine, and medetomidine. And the other is MK, medetomidine, ketamine. Those are both available through compounding pharmacies and heavily used in the trade. Next slide. Considerations for tranquilization. You got to take all factors into account when you're doing cervid work. Facilities, people are around going to be helpful? Are they going to be in the way? How much is the animal worth? What's the weather like? You know, if it's 95 degrees today, I am not knocking out a white-tailed buck. It's just, he's going to die, and I'm not going to do that. What are the reasons for the procedure? Can it wait, or does it really need to be done? And I usually try to stack procedures to limit the number of times that I have to handle an animal, because handling is very stressful. Next slide, please. Temperament of the animal. Are they wild? Are they tame? How excited are they? Have they already been run around the pasture 300 times before you get there? How much restraint did it take before you sedated? How much time do you need to do the procedure? If I'm taking off antlers, it takes me 5 minutes an animal. So I don't need to knock them out for an hour. If I'm doing something painful, if I'm doing a C-section, I need them asleep and pain-free. But if I'm cutting off hard antler, I don't need any anesthesia. I can do them in a chute. Are they going to get turned loose? This is a real worry for wildlife folks. They're going to turn them loose and the local grizzly bears eat them. Or in this case, if I anesthetize an animal and it goes back in with its peers, are they going to beat it up? They immediately recognize that that animal is not acting right and will attack and sometimes kill it. And that fits in with the social hierarchy thing as well. A dominant animal, once anesthetized, is going to get its ass kicked by the non-dominant animals in the group. Next slide. And hazards. I've had animals get anesthetized and drown because nobody was watching them. Do you have the medication available? Personnel safety. Volume restrictions. If you're shooting a 22 cc dart, they don't make those. So you're limited sometimes. And then cost benefit always comes into play for me, and especially in large groups of animals. Next slide. I don't think they offer this course anymore, but you can look for it. It's a great course if they can still find it. Next slide. Charging, I typically charge by time, not procedure, unless I'm doing lap AI or semen collection. Typically, it's by time. That encourages producers to have good facilities, have them up where I can work on them and do things. I will tell you, you never should be in a hurry when you're working on cervids, if you can help it. I always block them out, extra time for disasters to happen, or the while you're here, doc. And I usually schedule them for early in the day when it's cool, during warmer weather. And I almost always have a backup plan. Next slide. Reasons to start. Next, it's a challenge. I love challenges. Clients are demanding our services and they'll actually pay for it. That's an extra source of income. I used to do a lot of weekend and work on stuff that I really enjoy doing. It doesn't require a boatload of equipment. You've already got, unless you're getting into specialized stuff, you've probably got all the equipment you already need. It's very rewarding. Clients are very appreciative of you working on animals that they've had a hard time getting help for. And quite frankly, the client's expectations are usually pretty low because they know animals are going to die. It's hard to find deer early enough in a lot of disease processes to catch them in time in order to treat them. So clients really, really appreciate any help you can give them, and understand if you just talk to them that, hey, I haven't done this before, but well, nobody else has either, so we're just going to do it. Bone is bone, skin is skin, physiology, the heart still works, the lungs still move air, those types of things. It's lots of fun to do this sort of thing. Next slide, and I think maybe last slide. There you go. The end. And I will take questions, and if you've got them, and I love to take pictures of sunsets. I'm bored with all the tears.
This is Dr. Shane Holzer again. Dr. Shipley, my apologies for loading your older slide set instead of the current one.
I'm terribly worried about that. I'm really, really upset.
You did great though, no one can tell. You talked about TB. Just for people on the call in New York State, if you are interested in doing tuberculosis testing on the captive cervids, just reach out to either our office at New York State Ag and Markets or to your local field veterinarian, and we'll get you certified. And then 3, Tina Cookingham, one of our animal health inspectors, is going to read the questions to you, Dr. Shipley.
Okay.
So she'll get them out of the chat for you.
I'll turn my hearing aids up.
Good evening, everybody. I'm going to start with the first question in the chat, which asked about recommendations on sedation and what your thoughts are about working on deer in the spring when does are pregnant.
Sedation is actually really easy for me if I do the following. Okay, I know the species I'm working with, and I'll choose elk as my species. They're generally farm-raised elk are generally pretty docile, and I say they handle like a wild Angus cow almost. They're not too bad to work on. So I usually don't need, if they have good facilities, to do much sedation. But if I do, it doesn't take much, as opposed to a whitetail that's never been handled in a bad facility and is scared of every human being that's ever been around it. And that deer may even be hard to do a remote injection on with a dart gun. So facilities and the species I'm working on, the procedure I'm doing are all important in my selection process. And I'll just tell you what's in my drug kit right now that I typically use. I've got concentrated xylazine and concentrated ketamine. I've got azaparone. I've got MK2 and atipamezole. And I can reverse the alpha-2s with the atipamezole. The ketamine is a great drug and is incredibly safe to use to top off or in combination with the alpha-2s. And that, well, I can anesthetize almost anything with those drugs, almost anything. So, and none of them cost a tremendous amount. Xylazine ketamine, I used the other day. I de-antlered 13 elk for a guy, and I knocked him out with xylazine ketamine, and I added just a touch of azaparone, and they woke up very incredibly smoothly and went down very, very smoothly. So what was the second half of that question?
It was dealing with does in the spring, does that are pregnant in the spring.
It depends on how close they are to parturition, but I have had to TB test does that were that fawned within a week, but they were in a good handling system, a good drop chute. I prefer to quit handling them about 30 days before parturition. But the caveat there, once again, is a good handling system. If they don't have a good handling system, then I may even back that off to 60 days prior to parturition. It's very, very stressful on them. And most of them are having twins, lots of triplets, etc. I'm really not worried about so much gut as I am udder drop chutes when they struggle. I've seen a number of burst udders, and they're just ugly, ugly, ugly.
The next question is it considered inhumane to de-antler without some form of anesthetic, sedation, or pain medication? And they were referencing, dehorning in cattle, or is it considered acceptable?
It's not acceptable. And the North American Elk Breeders Association and the international community all recognize. I mean, I spent some time in New Zealand, and that's where most of the red stag are velveted. They have specific rules and regs that have to be followed for velvet antler. And so, yes, they need either local or systemic and anesthesia. Quite frankly, and I put on velveting seminars. Typically, they're de-antlered with a latex band for hemostasis and a local, and quite frankly, that's typically all that's required. They go right back out, pasture, eat. No real problems with pain afterwards. Not like I see with cattle, where if you dehorn them, as soon as the local wears off, they kind of hang their heads a little bit. Next question.
The next question is, can EHD be spread iatrogenically by the reuse of needles in deer like BT can in cattle?
Was that CWD?
EHD.
Oh, EHD? Theoretically, yes, because if the deer is viremic and you have blood and with the virus and you stuck it in another deer, you could theoretically, but typically if you talk to the experts and there are a number of people doing really good work with EHD. It's basically spread by a culicoides gnat biting an infected animal, and that's viremic, and then biting another animal, and it's spread that way.
The next question is, what are your thoughts on use of multimin instead of muse?
Multimin's a really good product because it's got copper in it, and Muci or Boci don't have copper. So if you're using Boci or Muci for their vitamin E and selenium, that's great. If you're worried about copper, then you're probably going to be using the Multimin product, and it's got selenium in it as well. I do have a few producers who have how should I say, they're really bad at reading models and literature, and have given way too much selenium, and too much selenium will kill them. And I can show you the necropsy reports to prove it. So all things need to be discussed properly, and the Wild West days hopefully are grinding to a close on some of the wildcat medication protocols that people come up with.
The next question is, what should liver copper levels be?
Off the top of my head, I don't have a clue, but I think you're looking at, depending on who did it and whether it's dry weight, wet weight, I think you better be well over 100. If my memory serves me correct, and I'm old and don't remember shit, and I have to look it up. But I think Michigan State does the vast majority of copper analysis, microminerals, and they have some reference ranges and usually print them at the bottom with the disclaimer of the page. But I have seen a lot of cervidae die from primary copper deficiency. So it's really, it should be on your radar.
The next question is, what's a Pritchard nipple? But then farther down in the chat, it looks like somebody else nicely put a photograph of it. So I don't know if you want to touch base on your use of that.
Yeah, Pritchard nipples have a little valve, flutter valve in them, so the bottle doesn't collapse and the air and the milk comes out better, and it fits better. If you have a deviant practice of looking at teats on cervidae, like I do when they're tipped upside down doing lap AI, they don't look like lamb nipples and calf nipples. They're small, and so the Pritchard nipple is closest of all the ones on the market that I'm aware of that work. And I've in my repertoire, I've got every artificial nipple that I've ever been able to find on Google. I've got them from international sources. Pritchard nipple just seems to work very nicely in almost all situations.
Next question is, if you're putting antibiotics in the milk replacer, are you writing a VFD for that?
Depends on what we're doing. I'm not writing in VFD because I'm treating an individual animal. If I'm putting a coccidiostat in there, I don't require a VFD for that. And I guess I've never medicated an entire group for it. Usually it's an individual fawn or calf that I'm treating, so that doesn't require a VFD. But I could see you writing one if you were treating a large group of animals and felt more comfortable doing that. But so that's going to depend a little bit on what you're doing.
The next question was, I think, about a picture that you had up on one of your slides. It said, what was going on with the fawn, stripped or degloved tail?
Actually, I see this fairly frequently. I see it probably a couple times a year. You'll get some does that overmother, and they're licking you got to lick the doe or mother licks the feces and stimulates them to defecate and to urinate and cleans them up, and you'll get an occasional mother that's overzealous and chews on the fawn's tail. And I've seen that in lambs and kids both. So it's not just a deer thing. And that happened to be a fawn that I had in a fawn cradle, and I had done an epidural on it and was putting a green rubber band on it to take the tail off with.
If white-tailed deer don't get brucellosis, why do some states require testing for entry?
That's something that's been undergoing great debate. The USDA has proposed dropping it from the requirements for white-tailed deer. I'm serious, but getting anything added or taken off the books is damn near impossible. And the article that was printed that was based on was, I think, of 1936. Indicating brucellosis in a white-tailed deer, and it just grew a life of its own. And since elk get it and other cervidae get brucellosis, it's not bad to have it on the books, but to run animals through just to test them for brucellosis, white-tailed deer, anyway, is a great danger to the deer and the producers as well. So I wish they would get that taken off the books, but I don't look for it to happen anytime soon. It's been talked about for the last 6, 8, 10 years, and nothing's ever happened.
The next question is, what West Nile virus vaccine do you recommend, and do you use an equine vaccine off-label?
You're using everything off-label, so use a killed vaccine and give it frequently. You know, you don't have a choice. I don't know of anybody making a reindeer vaccine, so I use a killed vaccine and do at least two shots initially and a booster, and young stock get 2 and then another booster, so yearly. So you don't forget it.
Is there any scientific evidence to feeding of hoof supplements like a biotin to boost antler growth?
There has been some research done on a variety of different things that quote could help antler growth. If you're feeding a balanced diet, probably there's nothing to do. And there's been lots of studies done with low protein diets and low calcium, low phosphorus, low copper, etc. If you don't have the nutrition, they aren't going to grow antlers. So good balanced ration that's adequate in protein, adequate in vitamins, adequate in minerals is probably nothing's going to add much to it, because most antler growth is genetically controlled, highly heritable, 0.5 to 0.6 heritability factor on antler. And so you're going to do most of your antler improvement through genetics. That said, supplementation with some things, and it's talked about a lot in the industry. I have been on hundreds of farms probably now, and I have never seen anybody feeding anything illegal or to promote antler growth other than doing just genetics. But I will tell you, anecdotally, I have heard of people using things like MGA, and there's a paper on fallow deer with it being fed MGA. I have not seen any papers on biotin, but certainly biotin's not going to hurt anything. And then I've also heard of people using BST. And once again, I have not been on any farms that have done that. And the other is, well, I'm drawing a blank now. Paline, used off-label, and I've heard rumors of its use. And since it's a metabolic agent, I would expect it to have some effect.
And it looks like your last question is, can or should rabies vaccines be given?
That's a really good question. And I think it depends on your area to some degree. If you're in a rabies endemic area, you might want to put it on your list, with the caveat being that deer are very curious, but they're also incredibly quick. And I would never, and I think the cases reported of rabies in deer are very, 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 very rare. I.e., they aren't going to let an animal walk up to them and bite them. And so in areas with no risk or low risk, it may be an economic issue. In areas that are high risk, it probably could or should be on your vaccine list. Once again, extra label. Nothing's.
All right, thank you. Those are all the questions that we have from the chat.
Okay. Go out there and treat them. It's fun.
Thank you, Dr. Shipley. Very much your passion and your knowledge about deer definitely come through. So appreciate it very much. And thank you everybody who stayed. Thank you for supporting this, and Hope you all have a good night.
Take care.
Take care,
Bye,
everybody.
y'all.
Bye.